Welcome to the Journal Club for this week. This is a case report with a 3-year follow-up with the title of Conservative Management of Internal Root Resorption in a Large Periapical Lesion with a Combined Non-Surgical Treatment and Decompression. It was done by Martinez et al. And newly published in the JOE. Managing a large cyst-like periapical lesion associated with internal resorption present a challenge, particularly when non-surgical treatment were unsuccessful. Decompression is a minimally invasive surgical technique which offers a conservative alternative to enucleation and apical surgery, especially when the surgery is contraindicated or not preferred. So this case report explored the potential role of occlusal trauma in the etiology of internal root resorption and present a successful management of mandibular incisor with a multiple resorption lesion and a large cyst-like periapical lesion. They had a 51-year-old male patient that was referred to the endodontic clinic with a swelling in a sinus tract that associated with tooth number 25. He was classified as an ASA2 according to his condition of having controlled hypertension and hypercholesteremia. And he reported having a pressure sensation in the mandibular region. Upon examination, we can appreciate that the patient had a mandibular tori, anterior crowding, anterior crest bite, and tooth number 25 was discolored, tender to percussion and palpation, and showed traumatic occlusion within a class 1 mobility with normal probing depth. And after taking both PA and CBCT, we can appreciate having a multiple internal root resorption defects and a large through and through periapical lesion in the mandibular incisor that displaced the adjacent teeth, which is most likely because of an occlusal trauma. They diagnosed the case as pulp necrosis with symptomatic apical periodontitis, and they start the treatment of a non-surgical root canal treatment through multiple visits. And after they done with the treatment, they did a follow-up at 6 months, where the patient present with the same symptoms, same lesion presentation within the radiograph, and the other adjacent teeth were still within normal limit. So they planned for decompression. They placed the drain and they follow up the case. At 4 months, they remove the drain and they continue the follow-up visit at 6 months, 12 months, then yearly. And within the 3 years follow-up, we can appreciate a complete clinical and radiographic healing. So to conclude this case report, emphasize that decompression is an effective conservative technique for managing complex periapical pathology that associate with multiple internal root resorption lesion. Decompression facilitates the complete resolution of the large cyst-like periapical lesion without the additional need for surgical intervention to preserve the adjacent structure and achieve an excellent clinical and radiographic outcome. And thank you.